Okay, so for today, we're going to be doing the skill checkoff for the abdomen for a health assessment. So first thing you want to do always is introduce yourself and then give the patient privacy. Patient here is Mr. Teddy Bear. So first name's Teddy, last name's Bear. Anyways, let's get into it. So first of all, my name is Neil Lingat, and today we're going to be looking over the abdominal section today. We should be assessing for everything, making sure everything's okay. And date of birth, Mr. Teddy Bear, September 4th, 2000. All right, perfect. So now I'm going to perform hand hygiene, give patient privacy, which is close the bedroom door. So during this assessment, patient can be sitting down doing this. It'd be easier for them, and it'd be easier for the nurse doing this as well. And also, you're gonna ask the patient questions such as their appetite. Are they having any dysphagia, any food intolerance? Are they feeling any pain in the abdominal area? Do they have any nausea problems, vomiting problems? What's their bowel movement like? Do they have a past with any abdominal surgeries or any histories of complications, or any current medications they're taking for their abdominal, and just overall nutrition? For Mr. Teddy Bear, he doesn't have anything except for maybe a little bit of bowel movement problems. Patient isn't necessarily pooping right. Maybe poops about once a day. Sometimes he'll go a few days without it. I might recommend going on a higher fiber diet just to get the bowel moving. So anyways, let's get started on this. Let's get into it. Let's do it. So inspecting the patient's contour right here from the side. Patient's contour is relatively flat, no problems at all. If it was rounded, anything else, it'd be kind of something you want to keep an eye out for. Okay, now that we got that out of the way, you're gonna look at the umbilicis, if I said that right, making sure that it is centered and midline and inverted. And just taking a look at it here, the bow tie kind of gives it off. It is perfectly intact, normal, exactly what you want to be looking for. Skin turgor, considering it's a teddy bear, we're going to assume the skin turgor is good, but for the sake of video, I'm going to be demonstrating it. After pinching the abdomen, skin does return to a normal spot within less than 2 seconds, so we don't need to worry about any tenting there, which is pretty good. As far as visuals concerned, patient doesn't have any scars or any noticeable or any piercings that could be present on there, so that's pretty good. It's pretty good. Now, usually you're supposed to look for pulsations or movement in the aorta, since it's a teddy bear, and teddy bears don't breathe, hopefully. We're going to assume that patient is breathing just fine. Hair distribution, it is a teddy bear, but in males, I believe you're going to be looking for more of a diamond shape, and then in females, it's a triangle, I believe. It's either a triangle or an inverted triangle. Not that I can't be specific about. As far as patient demeanor is, patient is pretty calm. He's pretty alert. He's not reacting to anything that I'm doing as far as touching up on the abdomen. He's not flinching to any pain, which is pretty good. So now we're going to auscultate the abdomen. What you're going to do here is you're going to start clockwise in the right lower quadrant. So right lower, upper right, upper left, lower left. And you're going to want to do it on the wide side of the stethoscope. You will listen to each side, you listen to each quadrant for at least 1 minute. So for the sake of this, I'm doing it for at least 30 seconds. So now you're going to be listening. So now, after you acetate the quadrants, you're going to be listening to vascular sounds, and you're going to be doing that with the bell of the stethoscope. So not the wide side, but the bell, which would be this part. So then basically you're going to be listening to the aorta, the renal abdominal section, the iliac abdominal section, and the femoral artery in the abdominal. So, yeah. Okay, sorry about that. After you listen to the aorta, the renal, the iliac, and the femoral, you're going to want to percuss again in the quadrant area in a zigzag, going clockwise, starting in the right lower quadrant. So just like that. Afterwards, then you're going to want to palpate in the 4 quadrants again using 3 fingers. You would gently press on the abdomen, starting in the right lower quadrant using circular motions. So like this, and then deep palpations. And then also you want to be monitoring for facial expressions. And clearly in the teddy bear, there is no type of facial expression. He's not showing or grimacing to any of my reactions. No pain is given right there. And then what you want to do is discuss your findings with the patient. So with the teddy bear, the teddy bear's abdominal section is perfectly normal, perfectly healthy. Everything you needed to find was there. Absolutely no anomalies. So you don't need to worry about anything. So that being said, if I need to redo this again, Professor, I can redo this. I have been sick a little bit. I do apologize. So if at any time you need me to redo this, I can totally redo this. This is fine. Thank you.